folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, spinal decompression made easy. We got amazing pain relieving results with this sometimes if it works on the right person.
Sure.
And you can testify to this yourself because you use it.
And I've done it with just recently, last 2 patients in the last 2 weeks. I've been using these techniques. Very simple to do. You can do them at home. And
you give them a try and see what you get.
But
if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And please also go over to the Facebook and like us. People are following us by the hordes now. It's Bob and Brad, and if you like us, we'll send positive vibes your way.
There you go.
Feel them hit you right now, right in the head.
Spinal decompression.
What are we talking about, Brad?
You know, this is one of those terms that it really wasn't seemed to be used that much years ago, and more so now. And I don't know if it's
becoming more popular. Or?
Yeah, if it's kind of just one of those terms that's someone
more in vogue right now.
Yeah, exactly.
Yeah.
But you know, another term would be like traction.
Right.
You know, traction.
That's what we used to call it.
Right.
Traction.
Traction was used very commonly years ago, and then surgeries came along, and then traction on the spine is not as common anymore because surgery is easier and but not always necessary. You know, and sometimes this part is skipped and it goes right to surgery. You know, it's like what's the old saying? If you show a carpenter a nail, they're going to use a hammer immediately. And
yeah, anybody who has a hammer, everything they look at it needs nailing.
Right. So, in other words, if you go to a surgeon, they think surgery. They skip the conservative route sometimes. I don't want to get any surgeons mad at me.
That's right. We like all people to
But anyway, so decompression is traction. So we're going to talk a little bit about why would you want traction or your spine to be decompressed or pulled apart. So, here's a spine. We're trying to pull it apart and really actually elongate it to a degree. We're not doing this in any great amount of length.
Large amount, no.
It's not like we're going 2 inches taller or anything.
Right.
But if we look at these are our cup vertebrae. If you've been watching our channel, you know we use these for a demonstration on a regular basis when we talk about the spine.
So we took 2 of the bones out of here and we made them larger.
Right.
And there they sit.
The bones would be the vertebra. Yeah. And then the green ball represents a disc. And a disc in the human body is not a solid piece of cartilage or whatever. I kind of thought, that's why I used to imagine it before I got educated on this.
Like a hockey puck.
Yeah,
but
exactly. It's not. There's actually fluid inside the disc that allows the disc to act like a little shock absorber and allows movement in the spine. So if that disc starts to fail and through compression through the spine, that disc can bulge out just like that. You got a good close-up on there, and that's no good.
Right.
It hurts.
There's structures that can hit back here. It can hit the spinal cord or the spinal nerves and nerve roots. And it can send pain down your leg.
Right. It's a good way to get sciatica.
Yeah.
So what we want to do is take the pressure or decompress the vertebrae so that as we go apart and decompress them, it allows the disc to go back to its normal shape, take pressure off the nerves, and life is good again.
Yeah, and the nerves are coming out small holes too. So a lot of times just by opening those holes a little bit, you might take a little pressure off the nerves.
Right.
And if they're a little inflamed, there you can see some of the foramen, as they call it.
You're squinting pretty hard. It's like you can hardly see it. There you go. Okay, so there's, between every vertebra, there's actually 2 spinal nerves. We got 2 holes. There's all kinds of potential. Okay, so we're gonna decompress. Now there are very expensive traction machines. I worked with one a number of years ago, and they work very nice, but they're very expensive that help give traction. But you can just use gravity, and you can do this at home, or we do it, all these techniques in the clinic as needed. So the first one is just using gravity. Should we go ahead and use the chairs, Bob?
Sure. So you're going to need a couple of good solid chairs, though, depending on which way you do it.
Yeah, don't use folding chairs.
Should I do the tops first?
Sure.
So especially if you're holding on to the top of the chair, you need a good solid chair that's going to, test it a little bit to make sure you're not going to, tip away here. So, you know, I'm going to get my weight onto my palms here.
Yep.
And, you know, what you can do actually to kind of test this actually is just you can kind of lean forward with one leg to start off with.
Right.
And eventually even kind of go forward with both legs like this. And now I'm just barely on my toes.
So his body weight is being supported by his arms. So you want to lock your elbows out. It's much easier that way.
Yep.
He's got his toes, I don't know if you can see it, but his toes are still touching the floor.
But barely.
Barely. And then you need to practice learning how to relax your core or your stomach muscles.
Probably taking deep breaths would help, right,
Yep.
Brad?
And when that happens, that allows the spine to have some traction on it, and you get that decompression. And when that happens, now if you do this, the only way I'll have my patient continue to do this is when they take the weight, unload the weight through their spine, that says, oh, that feels good. You know, and it should give those immediate response. If not, it's not applicable. It's not going to be a treatment for you.
If it does, I would recommend that you do it like every hour then.
Right,
I mean, that's the whole thing. Don't think about, well, I'm going to do one treatment today. No, decompress that spine every hour and maybe you can get some results.
Right.
By the way, it might help to even put a towel or something on here, Brad.
Right, just to help the pressure on your palms.
Yeah, to help you pressure on your palms. So I start feeling it here, and you know, as I compare here now, this one's a lot more comfortable than this one.
Sure.
So,
yeah. Now you're going to hang like this for between 10 and 30 seconds typically, and then you're going to come back off. Your arms will get tired.
Yeah,
and
they will.
You're just not going to hang there for 20 minutes by no means. So again, 10 to 30 seconds, and it should feel comfortable and give that relax. If you got sciatica, that pain in the leg should start to come out. Then you know you're right on the money.
So if you want to go to maybe a little safer method, you know, if you can get down on your knees, you can start, you know, on your knees like this.
Yep.
And these are a little bit easier on the wrists then too because it's cushioned here. And now I'm just going to lift up. I'm actually going to be on the edge of the chair here. Can you catch that? Liz says she's seeing that.
Yeah. So right there, space there.
And again, like you said, you got to try to relax.
Yeah. This takes a little practice. For some people I have do it right away, and other people have to coach them a little bit.
I imagine it depends on the length of your body and the length of your arms. I mean, some people probably you're going to have trouble getting up, and other people are going to probably be well above here.
So the spacing with your chairs, etc.
Right.
There's always a component there. Bob, should we go to the other method? Instead of hanging that way, we can go right to it. If you happen to have a bar at home or something you can hold on to, like a pull-up bar, works really well. And it's nice to have one that you don't have to jump up to.
Right.
But like right now, I'm holding on here and I'm supporting the weight through my legs. I'm going to gently and slowly let that traction go through. And you know, right now I probably got about 50% of my weight going through my arms and my back. And it feels good.
Now you've become a big fan of this one, Brad.
Oh,
I mean,
I love this.
Brad's got spondylolisthesis. And
I'm happy, Bob.
And a little spinal stenosis.
Yep.
And he really, really likes this one.
And the other benefit, can be really healthy for your shoulders too as well.
Yes, we've done a lot of videos on that, how it can, the stretching of the shoulders can help.
Now, if my hands didn't get tired, I could hang here for quite a bit longer in regards to my back and how it feels on my back.
And that's why they recommend sometimes is that you actually do wear gloves.
Sure.
I mean, it's just a little easier to hang.
But again, I'm going to say 10 to 30 seconds, maybe 3 repetitions. And if you get really positive results, you're going to do it, like Bob said, every hour until that leg pain or that back pain goes away. I do it for maintenance, even though my back doesn't feel good. It still feels good when my back is feeling good. You know what I'm saying?
And maintenance. I do pull-ups twice a week, and I always hang, you know, in between, and
part of the pull-up.
as part of the pull-up regimen.
Sure.
So.
Okay.
You want to show manually how you can do it to somebody? Or?
Sure. Why don't you? You want to lay down, Bob?
Sure.
Now, this is something I do with a lot of my patients with back pain. When I'm doing assessment, oftentimes as part of my initial assessment, we'll do it on this side. I'll gently grab, I'll say, can you just relax a little bit? And I'll gently grab their ankle, and I just gently pull.
So are you pulling on the side that generally has pain, Brad?
Typically, but I'll pull on one side, and I'm not pulling hard, I'm not jerking, I'm not getting weird. I just pull gently, and I say, you know, I'm not pulling very hard, am I?
No, not at all.
And when I pull this hard, if that person says, boy, that feels good, then maybe I'll go a little harder, but I'll only do it if it feels good. It makes the pain go away. You're not going to do it if it makes it worse, for sure. So I may do one leg, and I'll assess the other leg, and then I'll actually do both legs. And like I said, in the last, 2 weeks, I've had 2 different people where I've used this treatment. And I usually go for 30 seconds because then I get tired. But then the one lady, she had a son, and her son would do this at home. She lay in the bed, and it worked out really well. He did it 2 or 3 times a day for about 10 to 20 seconds.
Well, the other thing Brad and I were talking about is that if this does feel good, then maybe you do want to go on to what the next topic is, getting a traction device. I mean,
Right.
if it does help.
Sure.
You know, you may want to formally get a inversion table or something.
We do have a good video on inversion table. It's been pretty popular in the last year. But, you know, that's the table where you lay down like Bob does, and there are clamps. Well, they're cushion clamps.
Right.
They're comfortable. I used to have one on your ankle, and then the table tips you, and then your body weight from your trunk acts as the weight for the traction. And so inversion tables can be an option. I wouldn't just go buy one, though. I would go to a store that has them, and you can try them right there. That's what I did with mine, and that's what I have my patients do. Because if you spend $200-300 on an inversion table and you get on it,
Yeah, it doesn't do
and you
it for
get
you.
headaches because of whatever, you know, then you have to try and sell it again or take it back or whatever.
You know what I have done with patients, by the way, Brad, is I've done it where there's a manipulation I do where I have one person grab the leg, another person grabs their arms,
I think I was.
and then I do a manipulation.
Yeah.
And it works really good for mid-back. I mean, it's the only one that works on some people.
Sure, yeah. Maybe we should do a video on that someday.
Well, and on those cases, I'm having people pull as hard as they can. They're like, you know, the person on there, they're pulling as hard as they can, and the person on their arms is pulling as hard as they can.
Really?
So, yeah.
Do they get taller?
They should if they don't. So I see we're out of time here, Brad.
Okay, all right.
Thanks for watching.